I'm Judith Aronson-Ramos, and I'm the director of the Early Intervention Developmental Program at DiMaggio Children's Hospital, as well as director of my own private practice in Coconut Creek. Well, autism is an impairment in three areas: social, relatedness, communication, and repetitive or restricted areas of interest. So it's a behavioral diagnosis that we make based on observation. So there's history, of course, but also observation of how the child is interacting, speaking, their global development, and so forth. Some of the big red flags we look for are early signs of social and communication problems. So children who at 9 months of age, don't have language but don't point, who aren't babbling, aren't pointing, aren't making eye contact with their caregivers, aren't bringing objects to come and show their parents, aren't responding to their name. So we'll start around 9, 10, 11, 12, 13 months, 14, 15 months of age. When we don't see these things emerging, language, eye contact, social relatedness, responding to others, we begin to worry. Currently, it's pretty well established that there's a genetic foundation for autism. We don't have precisely the specific gene that causes autism. There's many different genes that are being studied, but there's an underlying genetic basis. So we have this underlying genetic basis, and then there may be things that impact that. There are triggers, and we don't fully know yet what all of those triggers are, but we've studied some of them. And one of the areas we've studied closely is vaccines. And to date, there's really no doubt that there is no relationship between vaccines and autism. And there have been numerous studies that have shown this over the years, very large studies in Denmark, in Finland, some in the United States. People are really looking at the correlation, and it's just not being borne out. So despite a lot of the controversy in the media, despite a lot of the popular press and what a lot of popular celebrities are promoting about vaccines and autism, we're really not seeing the correlation, we're not seeing the backup. And despite the fact that vaccine rates have remained stable or even declined, rates of autism have been increasing. So this is also another area of concern, as well as there are children who have been unvaccinated who still have autism spectrum disorders, and the millions of children who are vaccinated and don't have autism. So some of the concern really at this point in time does not have the scientific evidence behind it. It's important to vaccinate children according to the designated schedule because infants and young children are immunologically weak. So they're most vulnerable to infectious diseases at young ages. So it's important that we stick to a schedule early on and protect children when they're most vulnerable. So that's why we have to vaccinate children early. The risk of harm, injury, death, serious consequences from not vaccinating your child by far outweigh any risk of vaccinating. The important thing is that parents understand it is a spectrum disorder, so there's a wide range of abilities and disabilities even within autism, but also early intervention helps and it works. So getting your child seen by speech therapists, occupational therapists, physical therapists, behavioral therapists, treating the problem instead of running away because of fear or denial is so important to a good outcome. And there are many kids with autism who are doing wonderful. They have friendships, they're in classrooms, they're contributing to their communities, they're developing successful relationships. So the outcome is much better for a large number of children who do have autism.